Yes, thank you so much, Tina, and thank you to everyone who has joined us today. My name is Megan Ferraro. I serve as both the Executive Director of the Zach Foundation for Children's Safety and the Chair of the U.S. National Water Safety Action Plan. We're excited to have you all join us here today for a mid-year update on where things are with the U.S. National Water Safety Action Plan. We're excited to be joined by our friends in California, in New Jersey, in Hawaii. I see folks from Florida and Connecticut and Illinois who have all been working on water safety strategies at either the state or the community level. And as we head into this next week, where we will be marking World Drowning Prevention Day as designated by the World Health Organization, we know that it is more important now to both be kind of focused on this work and developing strategies at the state and community levels, but also to be sharing that work with our partners, with our networks, and to ensure that we are convening as many stakeholders in our communities, in our states as possible to this work. And so whether we're talking about marking World Drowning Prevention Day on July 25th, developing our state or community strategy, we want you to know that we here at the U.S. National Water Safety Action Plan are here to support you. We host these monthly office hours each month. And so you're always welcome to join those to ask questions, not only of the steering committee and of our amazing executive director, Tina Desart, but of each other. We've brought in the experts from Hawaii, from California, from New Jersey, from Illinois to join together today to answer those questions, to provide some best practices, to kind of moan and groan about challenges and to talk about how we can overcome them. We're also, looking at least here in the U.S., an increase in drowning rates, whether they are due to backyard pools or areas of open water during unsupervised time, or sadly to flood waters. We want to ensure that we're providing comprehensive resources and a way for us to collaborate and to convene as partners in this space. The U.S. National Water Safety Action Plan has provided an updated website over the last few months. So if you haven't had a chance to look at that website yet, you can enter it into the chat, watersafetyplan.us. During our conversation here today, we'd love for you to, and it looks like you all are doing it now as I'm talking, to put your name, your location, so what part of the country you're from, and the organization you represent in the chat. I believe we have some polls planned for you throughout this conversation, just to keep everyone engaged and to learn more about what everyone is doing. So you'll see those pop up throughout the chat. And we'll have a facilitated conversation that Tina will walk us through with all of the experts from around the country that have joined us here today. And lastly, this webinar will be available and posted. So if you're not able to stay for the entire thing, I hope you will. But if some of your partners or friends are not here, the webinar will be available for viewing. And Tina and I are always available to answer questions, so don't hesitate to reach out. Thank you so much.
Thanks, Megan. So the next thing I want to do before we get into kind of the state conversation is just to share some of the updates that Megan spoke of. So I'm going to take a screen here. Second. All right. Can everyone see the mid-year update slide? Okay. So we've had some new website releases. I threw the link to the website into the chat just a few seconds ago, so you can either follow along on the slides or you can play around with the website while we go through this. But really briefly, just want to highlight some of the new areas that we've developed for you as far as resources and opportunities for you to engage. So the first thing we want to touch on is the new resources that we have are located under the Tools for Action. So when you land on the homepage of the website, you'll see the Tools for Action tab at the top of the screen. I've circled it here in yellow. And so you just want to click on that. That takes you to this landing page where you'll see down at the bottom, if you scroll, there's a new highlight for national implications and then for resources just below it. So we're going to start with the national implications. There are 40 of these. When you land on this particular page, it will populate 5 initially, and then you'll have the option to populate an additional 5 as you scroll through them, just so that we didn't overwhelm the page and your visual sense as you hit it. So when you get here, you'll see a couple of things. First is this bar here where it says unassigned, active, finalizing, and completed. These national implications were intended to be developed, right? There are things within them that we want to develop in order to help sustain and help support the recommendations that we pushed out just over, well, 2 years ago now. And so each of these kind of sandwiches those recommendations to help support them from a national perspective. So if you click in, we're going to click into this first one, which is entitled NI1. That's just a code so that so we can track them as we go through. But really this one is showing as active because there is a working group currently focused on a portion of it. This one is focused on legislation and an advocacy toolkit for residential pools. So when we click into it, much like the recommendations, we give a breakdown of the detail behind this particular implication. So you can see the actual national implication at the top, the working group that's been assigned to it or that's working on it. This could be a university, this could be an organization. In this case, it happens to be a facilitated group by the U.S. National Water Safety Action Plan. And then below that, we have a space for progress notes. And as we really dive into these will get a little bit more detailed, but you can see as of May 22nd, we were finalizing the draft template and toolkit for adoption of this particular code. So that working group is in process and trying to get this work done and out to you. For each of the national implications, they are also tied to recommendations. And so below, you'll see the recommendations that are addressed. This one had a whole slew of them. And so you'll just see here we have BEE 1 through BEE 8 on the screen. There were several more. I just didn't want to add them to the screenshot. But when you click on these, it takes you right over to the action recommendation space where you can dig in a little bit deeper to that specific recommendation. So everything is directly linked to make it really easy to find additional content. At the bottom of each of the recommendations, so I mentioned the working group component. If you have interest in any of them, whether you want to champion one, your organization is willing to take something on, or you want to be able to participate as part of an existing or future working group, then we simply ask that you fill this out. It just shares your contact information with us and why you're interested in this particular implication, and it sends us a note so that we can add you to either an existing working group or a list for future work. And that's available for each and every national implication that you come across. So the next space that we've added is the resource page. So again, if we go back to this tools for action, down below the national implications is the link to the resources. And that brings you to this landing page. So across the top, and we're going to go through these slide by slide, but you'll see direct links, engagement opportunities, recordings now available, case studies, toolkits, data resources, and funding opportunities. So each of these links down the page so you don't have to scroll as much, which is really nice. So we'll start with engagement opportunities. This is the same content that you also find at the bottom of the homepage on the website, but now it's a much easier direct connect to find the information. So if you go to the resources page, you can find this right at the top, and it will show you all of the office hours, any other additional interest groups or educational opportunities that we've been made aware of will be posted here, along with any links that need to be included. The recordings are also available on the resource page. So for example, this particular session today will show up in this big box at the top underneath recordings now available once we get it posted. There are a number of recordings already available, both we have the state of the plan, we have this PHTA webinar, the Uniting for Safer Waters, we have a webinar series that we've started that has to do with drowning data and how different states have accessed their drowning data. And so take a look at these. They're all hosted on our YouTube channel, but you can access them directly through our website. Scrolling down a little bit further on the page, we'll find case studies. The majority of the top, let's see, the top 4 are actually directly linked to the plan document. So this is the content that is built into the plan itself, and we've simply provided a landing page for it to exist. And then as each of the states or communities begin to develop and launch their plans, we are also adding them. So you can see the California Water Safety Strategy, Hawaii's Water Safety Plan, and New Jersey's Water Safety Strategy are already listed here under case studies. Just another easy way for you to access relevant information. This takes you to the direct landing page where you can locate their strategies. And then we have toolkits. Currently, the World Drowning Prevention Day toolkits are what's up here. And then we also have an AAP guidance document on inclusive anti-bias language. Additional toolkits, like I mentioned, there's the one from the National Implications that the working group is currently working on. That will be housed here once it's done. So anything and everything that would be needed in order to move a project forward from a toolkit perspective or legislative advocacy tools, they'll be located here. Below that on the same page, we find some research and related articles. Again, these are populated just based on current interest and things that have come to our attention. So we have a couple of research papers that are listed here, and then we have World Health Organization content that we found would be really relevant for folks to dive into. Below that, we have data resources and funding opportunities. So they're broken up into 2 different boxes, and these are helpful for anyone, right? At any level, whether you're working on a state, county, or community plan. CDC Whiskers, CDC Wonder, we're going to be adding additional data resource spaces into this as well. And on the right side, you see the funding opportunities. And currently, these seem to all be related to swimming lessons. Typically, that's about where funding comes in this particular space. So, you know, certainly if you have recommendations for funding that might help support plans, then certainly that's something that we're willing to look at and potentially add to the space as well. So that's the resources page in a nutshell, just broken up into several different slides, but it's simply you scroll down. And again, across the top of the home of that particular screen, you can click on those links and it'll drop you straight down lower into the page. The other thing that I wanted to bring up is the report actions section of the website. So currently it lives here right next to the tools for action on the home page. If you click on this, it gives you a general idea of what we're looking for, right? So if you're working on a state, county, or community plan, or you're just getting into the space and starting to have conversations, we want to know about it. We want to be able to help support you. We want to be able to help connect you with folks who can help to guide you or provide some guidance on, you know, the pitfalls that maybe they ran into and ways that you can avoid them or suggestions. And so below that little section, you'll see this information. Very general is just asking for your contact information. If it's an organization or a coalition, then we'd like to know that too. And then what it is that you're planning and what your focus is. You'll see this implementation level component. That's simply asking, are you working on a community, county, or statewide plan? That way we have a better sense of how we might best support you. But this comes directly to our inbox. It doesn't go anywhere else. For the time being. And then you have the option to opt in. So 1, you can opt in to publish this information on the website. And 2, you can opt in to share this information with other collaborators. So if you wanted for us to be able to connect folks to you, let's say you finished a plan, you live in New Jersey and you finished your plan and you want people to be able to reach out to you if they have questions about how you did it, then we want you to check that box so that we have your permission to put them directly in touch with you. So along those lines, something that's coming soon is an action dashboard. So this action or report actions page is actually going to flip just a little bit. We're going to rename it to an action dashboard. And the submissions on that page that we were just talking about is going to end up turning into this visual representation of what's happening across the US. This is just a mock-up. I don't know exactly what it's going to look like at this point in time, but we're looking at highlighting the states that have developed a plan, We'll be bringing in kind of direct links to where you can find more information with their contact information. If they have social media, then we'll be able to link to their social media sites. And then the dots represent if there are county community activities also involved in this space in the strategy development. So this way we have a visual representation. Folks can look to, is there something happening in the state next to me? Is there another state that maybe has similar risk that we need to speak with them to help develop our own plan? Then this is a great opportunity for you all to kind of, it will help guide your process, I think, and certainly give us a better sense of what's happening across the US. The second piece that I wanted to share as far as what's coming, it goes back to the working group content. We've talked about this model legislation and toolkit to support adoption of the ISPSC for residential pools. That's what we talked about under the national implications previously. We have a national research agenda that's coming out by the end of the summer. We're really excited about that. It's still in a final drafting phase, but that came from the development of the plan itself. And so we're really excited to bring that to fruition. And then one of the other working groups that's currently in process, thanks to the support of Water Safety USA, is the development of recommendations for US Coast Guard approved life jackets and personal flotation devices in aquatic environments. So that's more of a paper and guidance for the lay person, if you will, and the general population. So we're really excited to see that come forward to be able to provide the much needed education and tools and resources for folks across the US. All right, so I'm going to pause there, see if we have any questions that anyone wants to throw into the chat on the website. All right. So let's talk about World Drowning Prevention Day really quickly. You've seen over the last couple of months, we've done a number of social media posts, a number of emails. We've had content on our website about submitting content for World Drowning Prevention Day. And so I just wanted to share, we had over 100 submissions. So thank you very much to those who submitted. And here's just a snapshot of some of the content that we've received. So I'm going to run through 3 slides here briefly, just to kind of give you a sense of the types of things that we've received from folks across the US. It includes photos, videos, social media posts. There have been documents submitted, certainly launch information for those who have launched plans. There are sample documents for specific things happening in communities. It's been a really well-received kind of promotion, if you will, and we're really excited to submit on behalf of the US this year. So thank you to those who have done that. All right, let me stop sharing my screen. And with that, we do want to ask how many of you did submit content for World Drowning Prevention Day, and whether or not your community is lighting a landmark blue on July 25th.
Hey Tina, it's Kirby.
Yeah.
Hi. I know that I'm not specifically doing anything, but I work closely with Natalie Valeris of Swim Global, and I know she's doing a ton of stuff, but I can't definitively say if she's doing the landmark
Right.
thing or anything like that. But
Yeah.
I do know she is doing a lot of stuff with World Drowning Prevention Day. So I did want to put that in there, even though I said no.
Yeah, no, and I have received a bunch of stuff from her as well. So
Or
what I
Natalie
will say
Martin.
too, yeah, from Natalie, what I will say too for folks is if you haven't submitted stuff already, the links are still live on the website. And we're not submitting until the final submission will go in probably at the end of this week. So if you have things or content that you still want to share, then feel free to submit that to us. All right, thank you for completing that poll. And there's the final result. All right, with that, I would like to introduce to you the 4 states that we have with us today. We have Hawaii, who we all know launched their plan in February, New Jersey, who launched their plan just recently, Florida, who is working on their plan, and then Illinois is just getting started. And certainly Illinois in the Chicago area had previously had a local plan. And so it's nice to see a kind of a transition, if you will, from something local to something more statewide. So we have a little bit of difference, obviously, between each of the representatives in each of the states, which is going to be really nice, I think, to see kind of how things have progressed and where things might make sense for you to connect based on your own infrastructure. So let's start with Hawaii with Allison and Kirsten. I'll turn it over to you for a quick update.
Aloha, everybody. So I'm Allison Schaefers. I'm a bereaved parent volunteer for the Hawaii Water Safety Coalition, and I was the lead writer for the Hawaii Water Safety Plan. We're 5 months post-launch of our plan, and our next steps include furthering outreach and government support, advocating for legislative priorities while continuing to grow our coalition and develop community partnerships. We rolled out our plan with a press conference at the state capitol in February. That was a strategic move to help us with our legislative package. During the press conference, we introduced 6 bills that were drafted and supported by the Hawaii Water Safety Coalition and recommended from the plan. 2 were in support of a pilot to partner with the Department of Education to provide in-school water competency lessons. Those bills stalled because we didn't have enough support from the State Department of Education. However, we have had post-legislative meetings with the Department of Education, and we're hopeful that will lead to future alignment. Our greatest legislative success this year, and personally very important to me, was the passage of Senate Bill 1221, Act 281, which was one of 4 bills. So we did that strategically to improve our odds at the legislature that the coalition introduced to address stormwater retention and detention pond safety. I think that's also a very timely topic given the Texas flooding that we've seen. It was signed July 3rd by the governor. It's named Sharkey's Law. It's in honor of my daughter, Charlotte Sharkey Schaefers, who was 5 when she drowned saving a child from an improperly flooded detention pond. As of January 1st, 2027, our counties will have to regulate permitting for retention and detention ponds. Submission of maintenance plans will be required, as well as mandatory safety measures, including fencing, no swimming signage, and accessible emergency buoys. The law also requires that each county will survey existing detention and retention ponds and submit a report to the legislature with recommendations prior to the start of the 2026 legislature. On the governance side, we are also continuing to grow our partnerships with the federal government, the Hawaii Department of Health, the Department of Education, and the Hawaii Tourism Authority, the state's tourism agency. A federal grant was secured to offer the YMCA Safety Around Water program this summer on Oahu for free to almost 200 children. Since the publication of the plan, there is ongoing support also at the Department of Health to hire a drowning prevention health educator. The first ever state-funded water safety campaign for young children is in development by the Department of Health, including water watcher cards. The RFP awardee is Kilohana, the tourism arm of a Native Hawaiian advocacy group and one of our partners in the plan, which runs the destination stewardship programs for the state tourism agency. Last year, Governor Green signed a bill into law that designated May 15th as Hawaii Water Safety Day, and we marked it this year by holding the 3rd Hawaii Water Safety Conference on May 16th. The event was funded by the Department of Health and was organized by the Hawaiian Lifeguard Association, the Hawaii Water Safety Coalition's umbrella organization. So now I'm going to turn it over to Kirsten Hermstead, the Executive Director for the Hawaiian Lifeguard Association and our coordinator for the Hawaii Water Safety Coalition, to brief you on the conference as well as the other next steps that we're pursuing.
Thank you, Allison. Aloha, everybody. You get aloha from us over here. I am Kirsten Hermstead. I'm the executive director of the Hawaiian Lifeguard Association. The Hawaiian Lifeguard Association is a statewide nonprofit that promotes water safety education statewide. Our board is made up of lifeguard professionals throughout the state, mostly our lifeguard chiefs, and then a few community members who have specialized expertise to support our mission. So we provide education for and training for professional lifeguards, community members, visitors, pretty much anybody who needs it. We have programming that we can take to them. Earlier this year, as Allison mentioned, the coalition became a program of the Hawaiian Lifeguard Association. And so we are doing everything we can to support the goals of the coalition and the newly published water safety plan. So we did hold our third annual Water Safety Coalition in May. It brought together about 100 members of the coalition from throughout the state of Hawaii. And one of our primary goals of this meeting was to really take a deep dive into the recommendations in our plan, and with the hope that we would come out with strategic goals based on the stakeholders in the group. And we also wanted to be sure they read the plan. It's meaty, it's a lot of pages. And we were getting the sense that everybody loved it and thought it was beautiful, but we weren't sure that they were truly reading it. So we took advantage of having everybody in one place and put them into working groups and asked them to take a segment of the recommendations and prioritize it. And then they needed to present those priorities to the group as a whole. It was very successful. There was lots of intense conversation, shall we say. But we did come out with some great direction from the members of the coalition. So there were four key areas that were identified as areas of focus that then had, subcategories attached to them. So policy was one. There was a lot of conversation about the definition of swimming and water competencies, because there seemed to be confusion about teaching kids actually how to swim and making them safe in the water. Should they, risk assessment, what happens if they fall in, all the things. So defining what that really means when we're teaching people to be safe in water. The third category was tools and technology, and then outreach and education. In the policy category, we have 4 goals this year. One is to promote a statute that requires the Department of Health here in Hawaii to recognize drowning as part of injury prevention. It currently is not recognized, and so therefore funding and all of the things that come along with that recognition are not happening. We also want to work to have the Hawaii Water Safety Coalition recognized as the water safety authority statewide. There was some recommendations that said we needed a water safety czar or similar position or marshal or whatever here in Hawaii. And we actually have the plan, and we have the coalition in place, and we have the Hawaiian Lifeguard Association already doing education. So we feel like this should probably not reinvent the wheel, but recognize us as the authority statewide. And then also to formally adopt the water safety plan by the state of Hawaii, to inform legislation and programs going forward. So it was very informative and very, what's the word I want? It worked. And we got great information, and it has given us a very clear path forward for the next year of work that we need to perform within the coalition.
Great. Thank you both very much. And I'm sure there'll be questions when we get to that point. So thank you very much for that update. All right, let's shift to Kate and Judith from New Jersey, having had a launched plan now for a couple of months.
Kate, do you want to start, our fearless leader? Judith wrote most of it, so I'm gonna put a little bit, but no, I do want to start. So we were super excited that we did launch our plan last month. And the one thing I do want to mention is we were like, wow, it's, we're doing it right before swim season. Are we gonna have, folks who are able to join our launch? We wanted to make it a big deal, right? It is a big deal. New Jersey is the third state to publish our strategy. And what we found is, especially with support from the Zach Foundation, that the media was so hungry for stories this time of year. So when you are working on your strategy, either local level or state level, really think about the news cycle because the media can really be your friend in getting it out there. And especially in New Jersey, it's a seasonal, pools and beaches are opening in Memorial Day or in June. Summer camps are opening in June. That's when we really see a spike in drownings, unfortunately. So that's when the news was super, they were hungry for these stories. So you may want to think about your news cycle and how to get your media involved. So if we launched this in December, I don't think we would have had the media support that we needed. And we had some really great coverage. So those are kind of some things I wasn't really thinking about when we were launching it. We're like, oh, it's right for summer. This makes sense. But we weren't thinking, or at least I was not thinking personally of the media side of it. And the media definitely is your friend in getting it out there. So those are just some things that you may want to think about. But we are super proud in New Jersey. We are the third state to launch the strategy. And I do have to say, it's a strategy, right? So we have our work cut out for us. We're already, in talks of, hey, we probably should have some more flood safety information in here or natural disaster information in here. So we're going to keep going yearly, annually. We do have a summit where we try to get out together as many stakeholders as possible. We've been really fortunate to have over 100 different stakeholders of all different, walks of aquatics, government agencies, fire, police, EMS, professional mermaids, a water safety dog who is now our mascot, all in attendance, which is amazing to get all these folks together. So we already have our third date on the book. So December we'll be meeting again, and how do we keep going with this work and revamp the strategy and keep it in the forefront of everyone's minds, because at NJSSA we do want to reduce drowning by 30% by 2030 in the Garden State. So that's kind of our goal, and we know data collection is a difficult piece, and that's something that the strategy talks about as well. So I don't want to steal too much of Judith's thunder. She was the main author of it, and she's also one of our board members. So I will turn it over to Judith to kind of go a little bit more into the nitty-gritty of the strategy. But we're super happy to answer any questions, lessons learned, anything like that.
Well, thanks, Kate. You made it easy for me. I do have to say this was a 2.5 year process. And without the Zach Foundation, we probably would not have been able to complete it in that amount of time. And also NESPA, the Northeast Pool and Spa Association, who have been incredible partners through this. We're a smaller state with less of a financial impact coming from the state. So we had to do a lot of this privately. However, we have awakened the sleeping giant. I am gratified. I've been in this business more than 40 years. I made a part-time living in college when water safety was a priority in New Jersey in the early 70s, and you could not graduate from a state school without proving you could save yourself. So I made a living teaching athletes who sunk like rocks to be able to swim so they could graduate from college. When that went away in the late 60s, early 70s, so did the interest in water safety. So did arguments about closing municipal pools if they weren't making money. I'm a retired Parks and Recreation professional who found her way into the water park business, but I never had to fight over a football stadium being built, or I never had to fight over a lacrosse field being built, but I had to fight for pools, and I had to fight for swim lessons. And I didn't think I would live long enough to see it a priority again in New Jersey. So I am thrilled to have been a part of that. And just as Hawaii mentioned, and you beat us just by a little bit. We're very competitive in New Jersey. I wanted to be number 2, and damn it, Hawaii slung in there. But we found many of the same things. And we came up basically with 6 strategies. Being the lead writer on this thing, 200 collaborators over 3 years, it is like wrangling cats. And every word in this document, talk about, did people read it? Did they read it? Absolutely read it down to the simple articles and whether or not they agreed or not. It took 2 years of Garden State water safety summits. First, to identify who are we, why we're here, and then ultimately to get us to be the, just as Hawaii mentioned, the go-to organization in all things water safety, to build the trust of these 200 collaborators so they would say, yeah, there's got to be one person at that table. And after all this and the incredible press upon our release, and Kate, you are right, I was agonizing because I couldn't get it done in time for May as Water Safety Month. But I do believe we would have been lost in the shuffle of Water Safety Month if we launched in May or at the start of May. It was perfect timing for us before camps, before the summer season at the Jersey Shore. And I think that really made us successful. So after those 3 years and 200 collaborators, we came up with 6 strategies. And the number one strategy is the one that every single state is talking about, and that's data consolidation and data. Even though the CDC comes out with their data, it is old. There are many definitions of drowning in New Jersey. One of our medics that came to our Garden State Water Safety Summit said they have more regulations on how to fill out the forms on venereal disease than they do when someone dies from drowning. Now that's pitiful because sometimes it's listed as a heart attack. You all know the drill. Sometimes it's listed as asphyxiation. Sometimes it's rarely out and out drowning or some other time of accidental death. So that was one of the strategies, and data consolidation. And it's interesting how we woke the sleeping giant, because suddenly the Department of Health is very interested in what we're doing, and they have come out with their own sort of drowning prevention plan. Swim safety awareness was the second, drowning prevention programs the third, lifeguard training and development and retention and training is huge. We continually hear about pools closing 1 day a week, 2 days a week, or closing because of lifeguard shortages. And we want to make it more equitable, to try to provide scholarships to get young people into these careers in lifeguarding and then ultimately perhaps aquatics, and make it streamlined. There are many arguments about the different certifying agencies and the age at which you can protect someone. We have kids that are 15 years old. We're asking them to save people's lives, which they do over and over again, praise God. But they can't drive a car. And yet they can't load you into a water park slide. So there are a lot of inconsistencies about deep water, mechanical operation of slides, etc., that all add up to what we need to do is to streamline that process. Sustaining and financing the mission, that's the big one. You can't have big dreams if you don't have some money. And we have done it on many levels, NESPA, the Zach Foundation, and even $100 at a time of small companies, organizations, affiliated organizations. So you need cash. It's the reality of it. And the government is not necessarily coming through with that kind of money for this kind of work. And the last is collaboration. And it almost reflects back, Tina, to the Light the Sky Blue and World Drowning Day. There are so many celebrations now of water safety, like May is Water Safety Month, that we'd be celebrating every week. Every organization has their own celebration, and maybe we need to kind of look at that. How do we come together and have one big super recognition or celebration? So, but the one thing that I'm really proud of, and is a sneaky way to get a lot of attention, is when you do your document. What we decided to say is, okay, these are identifications of things that we've missed in water safety. These are things that we need to see happen in water safety. But in the back of the strategy, listed all the things that New Jerseyans are proud of, and remarkable little things, all from a tiny little school district that makes sure their kids know how to swim, and they find a way to make that happen, to life-saving heroes, to our own bathing suit and goggle drive. When you talk about opportunities for financing and getting kids in swim lessons, we are so proud to coordinate with the New Jersey Recreation and Park Association and Dolphin Swimwear. I happen to be the chair of the New Jersey Bathing Suit and Goggle Drive. And last year we collected and distributed over 3,000 bathing suits to kids in need so they could get into swim lessons. In New Jersey, you can't get into a pool without appropriate swimwear, and it may be hard for some of you to believe, but in a state with affluence like New Jersey, along the Jersey Shore and tourism, we have kids that show up for free swim lessons with no bathing suit, and they have to sit on the side. And there's nothing more heartbreaking when I was a pool operator in a heat emergency to see a young person turned away because they didn't have a bathing suit. So thousands of bathing suits are coming in this year. They're going out so that kids get into public pools and swim lessons. And that's just another way to deliver the message. So the positive affirmations in the back of the strategy, the highlighting of who's doing good work in New Jersey, it was a little self-serving, I have to tell you. I'm a sneaky one. If you made it in a strategy, now you're our partner. Now you have to support us. Now you have to crow about us. So now we have more and more people. It's getting very viral. It's spreading from everything from a little boy who gave up his birthday presents for bathing suits for underserved kids to professional mermaids who are teaching how to be safe in and around the water. So we highlighted the good things that are happening while we identified the things we have to accomplish. And I think that's, in a way, how we were different. And I think the document, we wanted to make it really readable, layman's terms, so anybody could pick it up. So if you are in the development phases of that, keep it simple. Keep it, we're 60 pages. That's as short as we could make it, especially with all the affirmations. But we have made a lot of friends, and I didn't think I'd live to see the day. We have been called to Trenton multiple times, that's our state capital, to be the voice on several of our bills and issues. One is on the life jackets and making sure they're Coast Guard approved life jackets, on education in the schools, water safety education in the schools. So we think it's happening, but now the really hard work starts. So I'm feeling exhausted, but there's a lot of work. December 11th, Garden State Water Safety 3. Now we got to get down to it. I do like, Tina, where you talked about creating the working groups. We had working groups. We went from big discussion in Garden State 1 to working groups in Garden State 2. Now we sort of need facilitating groups. Yeah. All right, who's going to take on the beach water safety cards? Who's taking that on? So that when you buy a beach badge, you get a card that tells you all about safety. So now the real work has to start. The nitty gritty has to start. So it's not over when this gets delivered, although I did sleep with it for just a couple of nights, just to, and Hawaii, darn ya. Where are you, Hawaii? Aloha, you beat me right to the punch. I was wanting to be number 2. We're very competitive in New Jersey, but we're very proud, Jersey proud. And we made it happen on a very limited budget, thanks to our friends at the Zach Foundation and NESPA, the pool and spa people. And we have made really great relationships by doing this. The hard work is bringing it all together. So thank you for the time and the crowing.
Thanks, Judith and Kate. Really appreciate it. All right, so let's switch gears a little bit into those that are developing a plan still, right? They're not across the finish line yet. So Kirby and Tina, would you like to tell us a little bit about what's happening in Florida?
Yes, Tina, good afternoon. How are you today?
Good, thanks.
Tina and I are the co-chairs of the steering committee here in the state of Florida to create Florida's water safety strategy. As Judith alluded to, it's a time-consuming process. We've been at this for just shy of 2 years. We started in the fall of 2023, and the drive is higher than ever for us to finish the plan. Last year, my agency, Florida's Department of Children and Families, finished with the highest number of drownings we have ever seen. We had 105 reported to us. This year, we are already at 70. And I checked my statistics and my data, and we are 3 ahead already as of yesterday of last year's pace, which is horrible. So my drive is ever in place to get this strategy done. And since Megan happens to be on the call, I want to give her and Matt and Mike with the Zach Foundation a huge amount of kudos. I met with Matt back in February at the National Water Safety Conference, and since then he has kicked our development of the plan into overdrive. And so thank you, thank you, thank you, Megan and the Zach Foundation. Now, what I'm going to do is pass it along because I'm the data guy. I live and breathe data. If nobody knows that yet, that's what I do. And my coworker, my co-chair, and my work wife, Tina, is the one who is the scribe, similar to Judith in New Jersey. So I'm going to pass it along to Tina to talk to you guys.
Hey, I'm Tina Morgan. As you can see, we have the same last name, so hence the work wife, we get that confusion a lot. But so for the Florida plan, we are really on, we are almost there. We are in our second phase of revision, and what we did was once we first started, Kirby and I kind of like we've heard others talk here. We're going along, and it just didn't seem like anybody was picking up and moving this forward. So we picked it up and we started moving it forward by being the steering committee and creating a platform where we could get input. And then as we started to write it, it was becoming a little bit difficult to get input. And so the Zach Foundation thankfully came in and kind of helped us move that forward. But we, excuse me, we have 9 priorities. Like everybody else, data is a big one. Because you've heard Kirby just mention our data thus far this year and as of last year. But that's not all of the drownings in Florida. That's just those that are called into the Department of Children and Families. So we know that there's more than that out there. We just don't capture them because we don't have a means to. So for us, actually having a agency or a group of agencies that could come together and pool that data and really look at this as the robust issue that it is would be fantastic. So definitely data is up there. Not surprising for the younger kids, there is a majority of drownings that are occurring in pools. So pools for us are separate than open water, just because they're 2 different distinct groups that tend to suffer from fatal drownings there. We also have the lifeguards or rescue and CPR. What we have found is we have various different pockets where there are certification, free classes that are provided by different aquatics groups, such as Rosen Aquatics in Orlando sponsors a lot of water safety or water competency programs. So we have them, we just don't really have that built up that much. And it's kind of ironic because we have a lot of water, not only the coasts, but all of the amusement parks have at least 2 water parks, not to mention the other, resorts and whatnot. So we've sort of run dry in that pool of lifeguards. So it's not making it very sustainable. So we've kind of offered, a whole section there to talk a little bit about that. And what we did, thanks to everybody who came before us, because we read yours, we looked at it, we kind of, hemmed and hawed over some of what you have in there, and we kind of compared notes. And I think that we have a lot of the similar issues. So we utilized that to kind of help create this plan. And for us, we did have the water emergency preparedness portion in there already, because one of the responsibilities of the Department of Children and Families is to kind of help out in hurricane situations. So, for us, that's always kind of in our mind, thinking of like what that next event could possibly be. And the last one that we had tremendous and terrible flooding with it. So right now, as it stands, the plan is out for its second review. The end of that review is Wednesday of next week. So once everything is kind of gathered back from, so this would be everybody that has been involved in the plan, pretty much, looking at it and kind of putting their input in. We're going to take a little bit of time to kind of review it. And because both Kirby and I work for a state agency, and then Department of Health is also going to house the document here in Florida and kind of continue it as part of their Water Smart Florida group. Both of our agencies, DOH and DCF are going to run it up their chain of command, just to get the buy-in there as well. Also because we do speak a lot. We can't force legislation, but we do speak a lot about perhaps these things might be beneficial. So they need to kind of vet that. That process is probably going to take a little bit of time. If any of you out on the call are from a state agency, you understand why I'm saying that. We'll imagine 2 state agencies having to look at it, review it, and kind of bring it back together. So we don't know exactly when it'll be finished, but it is complete. We do have a place to house it. We do have a place to kind of continue with it. We have in the Water Smart Florida, and we'll also store all of our supporting documents as well as resources and as well as much data as we can. So hopefully soon we will be able to throw our names in there as one of the states that has it completed.
Great. Thank you so much. We're really excited to see how that comes out. All right, so we still have some time. So we'd like to bring in Laura Cochran and Amy Hill from Illinois, who are just getting started on the statewide plan there.
Yes, thank you so much for this opportunity. My name is Laura Carlin Cochran, and I work for DuPage County Health Department in Wheaton, Illinois, a suburb west of Chicago. And I'm very excited to share our first update. I currently manage a project called Protect Swimmers 10 Million. This is an initiative funded through the United States Consumer Product Safety Commission and the Pool Safely Grant Program. And so now I'd like to introduce Amy so that Amy can tell you about her work. Amy might have stepped off. We have our
Sorry, I didn't
task force meeting.
Oh yeah.
Oh, there you are, Amy.
We're gonna have to run in a second. First of all, thank you so much to Judith for meeting with us, and you gave us a ton of good information. I am the coordinator for Safe Kids Chicago in Illinois out of Lurie Children's Hospital, and we also lead the Metro Chicago Task Force, and we've been doing all kinds of work focusing right now on water safety messaging, because we have also had a lot of drownings on Lake Michigan this year. So Laura, I don't know if you want to.
Yeah. We started planning more of the expanded initiative earlier this year at the start of the year, after I attended the National Water Safety Conference. We really started talking about potential partners and collaborators in the process. We initially went right to Water Safety Task Force and spoke with members about their level of interest, and also if they had time, if they could dedicate staff time and resources that is already pretty limited to this effort. And a few of the members whose organizational goals aligned with that statewide perspective did decide to join our core working group. Illinois is a very large state, much like many of the states on this call. We have 390 miles between our northern and southern borders, and two borders of the state of Illinois are major rivers, the Ohio and the Mississippi. We have a Great Lake, Lake Michigan, and countless inland lakes and waterways. And so it is a very broad state, and there are very diverse interests in water safety in our aquatic environment. If you're looking at Chicago and the surrounding suburbs, and then also in our beautiful other regions of Illinois. So for that reason, we did partner with agencies that could bring a wide variety of perspectives to our waterscape, and also to our assets and also needs. And so our partners include many state agencies, Department of Natural Resources, Department of Public Health at the state level, our Illinois School Nurses Association, Illinois Park and Recreation Association, Illinois chapter of the American Academy of Pediatrics, Prevent Child Abuse Illinois, American Red Cross. We have excellent partners already in this process, and so many potential collaborators who are interested in the next phase of planning. And so that's a very quick overview. So thank you very much. Amy?
Basically, we are currently on step 3 talking, and today we're going to talk about waterscape and hazard assessments, and kind of go from there.
Great. Thank you so much. All right, we have about 4 minutes. I'm going to open it up if anyone has questions for whether it's for the plan, it's for the national plan, or for anyone who spoke based to represent their state today. You can throw questions into the chat, or you can come off mute and just ask them directly.
Tina, I just have one thing to offer that I forgot to mention earlier. When you're going into this, it can't just be let's get together and do strategic planning, because you will not be able to attract people, especially from municipalities or smaller agencies. You have to also offer them something. You have to offer them the opportunity of getting some education, perhaps panels, breakout groups, presentations, a keynote speaker. So as you start to do the strategic planning process, also build in that you have to deliver something else. And I think that was our success in getting out over 100 people each and every time, because they need the justification to get out of the office, not just, oh, we're doing some strategic planning for the state. And the other frustration is getting the state to accept it. You know, the State Department of Health loves us now, but getting the state to accept it, the governor did not come, the governor's commissioners didn't come, wasn't enough notice. Oh, la, la, la. If the TV cameras are going, usually they can get there. And then Kirby and Tina, you're welcome for us breaking in Matt and Mike, because if they had to spend 2.5 years with me, I'm sure Florida seems like a dream.
Well, thank you, Judith. I appreciate that. They only had us for about 6 months, February to now, 5 months. So I got great news. I can't say thank you enough to them, because they Judith, the way I equated it, hopefully you'll get this analogy and understand it. I said they felt like they were the guys that come in to steer the ship into the harbor when it's a tricky harbor to or they bring in the boat pilot to go through the Panama Canal, that kind of thing. They steered the ship and they pointed us in the right direction, and they kept us on task, no doubt about it. Because
Absolutely.
all of us on here are more than likely doing this in addition to our normal job duties. And you gotta keep the faith. And I'm keeping the faith right now because I'm doing 2 jobs. I'm currently doing my old job, which is child fatality prevention specialist for the center part of the state. And I'm transitioning into be the state child fatality data analyst. So once again, I live and breathe data, and I am dedicated to avoid us being Florida, because we're in the news all the time. So thank you.
Well, when you're ready for a great editor, I do have to say our editor who was able to wrangle me, Eric Fluitt, knows the aquatics business. And if anybody needs a recommendation on an editor, you can't go forward without someone wrangling you in the writing. And I've written books before. This was harder than that because I was representing 200 collaborators and I wanted to give them the right respect. So make sure you have a good editor to help you through the process. It's hard to put all that information into a place that's readable, entertaining enough to keep people's attention.
Thank you. Thank you. That's I'm the data guy. The other person, my work wife that was talking, she's the scribe. So she's the one who's going to heed that advice.
Stacy, do you have a question?
Yeah, I have a question and I have a comment. So I love the look of the Hawaii plan. I think it's beautiful. And I hear what you say about it being beautiful, but is it really effective? But I don't really want to pick up something and even look at it if it's not aesthetically pleasing. So I think that's vitally important. So it was great. I have a question for Hawaii, because you mentioned about the Department of Education. And I happen to be an educational advocate. I'm on the Florida team, but I deal with the Florida Department of Ed all the time. And we have in Florida, we passed a couple years ago, the Every Child a Swimmer. So we do have legislation here that requires information out to the schools. It's for newly enrolled students, which is concerning. And if you see by my little name there, I deal with autism. So, we have a significant number of children with autism who die. And so did you do something above and beyond, if you're familiar with the Every Child a Swimmer, did you do something above and behind with the beyond that with the DOE, or like?
So, yeah, We were trying to get actual water competency lessons in the water. And so that would have, the instructional time was an issue for them with all of the new requirements. So until I think it was late 1980s, Hawaii actually did have swimming lessons in the school systems, and it was funded through the legislature. It was a budgetary allotment that went towards that. But when, some of the streamlining where they took out arts and different things, that kind of was one of the things that got cut. So they were concerned about the instructional time. When we met with them, though, one of the things that came out is that they can now count those types of things in their PE requirements. So there may be a way to encourage them to do it. So then the other issue is pool facilities. Not every school has a pool and they want equitable. And then the transportation requirement would increase the instructional time out. However, we have some members who are working with mobile container pools already. And so that might be an option going forward. I think the other thing is when you work with a Department of Education at the state level, there's many different levels of bureaucracies that have to be addressed. And so we probably went out with that legislation a little too quick. We found that state departments themselves, like the Department of Health, while they agree that those lessons are important, any state department is reluctant at a policy level to tell another state department what they should be doing if they're not supporting it. So you really need buy-in from that department. So we're working very strongly at that. We're with working groups. So yeah, and I will go back and look at the Florida legislation too, just to see if there's something that we could take from that would provide an inroads for what we're trying to do here. But by and large, that conference that Kirsten talked about that we had on May 16th, that is the #1 priority in Hawaii, and a state surrounded by water with the second highest residential death rate for drowning in the nation and the leading cause of death for our children ages 1 to 15. We feel like every child in Hawaii deserves the right to be able to swim. And also, from a cultural standpoint, our plan also incorporated a lot of the culture of Hawaii, which is a strong water man and water woman culture. But those things are not necessarily getting passed down. And if we don't support that, our children they can't fully be in touch with their culture if they cannot swim in Hawaii. So we feel like it's really urgent. And just an aside on the water safety plan, couldn't agree more about readability. So I'm a journalist by profession and an investigative reporter. So that's why it helped. We did have the support of the Department of Health for the statistics, and I also know how to get them through public records. So that helped as well. In terms of the readability, I also believe, because I'm a journalist with a newspaper, that graphics are really important too. So I also worked with the team and oversaw the graphics. And I'm not going to lie, I sent it back several times. I'm like, it needs to have a look and feel that will make people want to read it. These graphics need to stand out. If I need to curve the writing back here, I'll curve the writing back. Let's go with the graphics. And then just things as simple as pushing back when the Department of Health sent me statistics and they used the word decedents. I'm like, let's just call them dead people. Can we do that? And then when we had residents versus non-residents, I'm like, so are non-residents visitors? Can we just say that? So there was a lot of pushback from me. I'm also an editor. So I'm the special projects and weekend editor for our local newspaper. And a writer. So that helped. I think having people on your team that can do that. And we didn't have any budget. We had $10,000. And then our partner in graphics provided that to us, a Hawaiian consultant group. But I donated all of my hours pro bono because my daughter drowned and it's important to me. And I think between May and February, May of last year and February, I had more than 500 hours in the writing of it.
Well, it definitely looks like a professional made it.
Yeah.
So that explains why it looks the way that it does.
Thank
And it just doesn't look overwhelming. It's got the white space. It's I actually used to edit a magazine called the Autism Notebook magazine. So to me, that's the way I look at it from that perspective. So one more thing.
Allison is very diplomatic, much more diplomatic than I am about the Department of Education. And currently, God bless you, Allison. Currently, it is listed in the health and phys ed curriculum in New Jersey, but there are no recommendations for that curriculum. So most recently, when we testified in Trenton to move it along, and it is now moving along, so it is moving through the Department of Education. Frankly, they're a little lazy and they're very slow.
Do you
And
have some proposed legislation, Judith? Because
we
we'd love
do.
to see that.
Yeah, I'd be
Okay.
happy to share it.
Yeah, I would love that because
And-
that is by and large our top priority in Hawaii. And that, although the retention and detention pond thing with climate change and flooding and the building of more of those is huge. And my daughter drowned in one of them. So I think that was a big win. The governor told us that normally takes 7 to 8 years to get a piece of legislation we got it through in 1 year. And you talked about strategy. So let me just reiterate, strategy as a media person is very important. So our strategy was to roll it out. We actually had the press conference at the Capitol, and we brought the book to every single representative and senator afterwards and gave it to them after that press conference. And we invited many to participate in that press conference. And we talked about the legislation in that press conference. And then we went the talk show route and everything else. And so that really, I think, helped get that bill through. And of course, having 4 different bills slightly different gave us the odds of getting that bill through a bit more. Although I'm not going to lie, 6 bills on top of rolling out this plan was a lot.
Well, we're on the same exact path, and I had some time in radio and television, so I had a little bit of knowledge of how to get in there and how to get the word out. But on the Department of Education, what we decided to do is to not only go there with the legislation, but go with an offer of assistance that we would either write the curriculum for them, suggest the curriculum for them, or bring the curriculum from New York, our friends in New York, which is already accepted in the state of New York, and bring that along with us because they are overworked, underpaid, la, 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 la. And so we said, okay, we'll come with a really nice package and make it really easy for you so you have no more excuses. And you can be taught water safety on dry land. Not everybody has a swimming pool. But what we're seeing, what I'm seeing, in New Jersey, we have so many young men dying in our lakes, drowning in our streams and our lakes, either drinking involved or fishing with no life jacket, boating with no life jackets. And what that tells me is we lost that gap. Like growing up as a kid, I knew stop, drop, and roll. I knew all these different things that were taught to me as a child. And we lost that for a long time in New Jersey, and we're paying for it in the lives of young men, in particular young men of ethnic origin, who maybe don't have command of the English language. So we are reaping what we didn't sow, and now we're playing catch up.
Well, and to the DOE, we have it. We have a bill, but it's the requirement piece that's missing because anybody who knows anything about education, there's a lot on their plate, but they only do what they're absolutely required to do. And if they're not required, then if they get to it at the end of the day, fabulous. But if they don't, they don't. And just want to make one more quick comment. Judith, I love what you said about how they pay more attention to this than this. Because Kirby actually just got an email from me about a week ago because we have a fire chief here who said, we have to write all these reports and give all this attention to carbon monoxide poisoning. But when a child dies, I'm not required to do the same things. And that's insane. So that's
when the doctor from Hackensack Meridian said to me, I have more forms for venereal disease than I have for a child drowning. It fired me up, so it got me through the rest of the process, but I got really fired up.
I have to good-naturedly joke with Allison and say, budget? What's a budget? I've been doing this just as a side passion to working in child fatality for the last 20 years.
That's all of us. The budget was more for coffee and lunch for everybody coming out, or for production materials and editors and, no
Right.
It's
budget.
also coming from a government employee. It's like
Yeah.
budget. What's a budget?
No, I get that. I just wanted to encourage everybody because we did our plan with $10,000 basically. So
That's awesome.
then it doesn't have to, that shouldn't be an impediment. Although we did have some people that had certain skill sets that were willing to donate, but don't be afraid to ask people to donate. It was interesting. I got a call from one of our coalition members at the newspaper, and she wanted just my advice on placing an editorial letter. And when she started talking about it, I said, well, this is something I could get on board on outside of the news organization. For me, I don't cover our stuff because there has to be a separation of church and state, but I got permission, and because of the death of my daughter, I was more than willing to do this. And honestly, it's almost like a full-time job for me, or has been. A full-time
It has
unpaid
been.
job.
It is.
But the coalition support made such a difference also in getting Sharkey's Law passed. And I think that's going to be important. And I'm looking to roll that out nationwide at some point, because we need if we're going to build more of these structures, we need to consider safety around them as well.
Yeah. I was a director in a town when 2 young boys got sucked into a detention basin, and it was horrific. And it changed New Jersey legislation from that day on. And so I feel and understand what you're saying. I have to say, we did it for $5,000 and then so impressed our partners that they gave us more money because they knew we were short. And so we did it for under 10, really closer to $8,000. And Kirby, $100 at a time. They all add up. Even small agencies, small companies, people started writing $150 checks, and we made it. We made
When-
it. But
Judith,
everybody
we
else
had-
donated their time.
We had the first in-person meeting for the water safety strategy on May 28th, where Mike was able to fly down with the Zach Foundation for it. And one of the other people that we're working, Tina and I are working very closely with, are the co-chairs of DOH's Water Smart Florida. And one of them, she's Natalie, who I mentioned earlier. She runs Swim Global. She was the one who got lunch provided. She was able to go and get people to donate. And so we have people there to do it. It's just, I joke about it because I'm a government employee. I can't go ask anybody for anything. So, but what I've found is, even though I can't lobby for legislation, the other recommendation is find the people that can. Put the information in their hands. Where I'm
Find
not
the
allowed.
people with the Rolodex. Find
I-
the people with the political Rolodex.
I can't lobby legislators, but if they want to ask me questions about statistics for the state of Florida when it comes to fatal drownings, I'll give them the information because I'm not lobbying either way. I'm just providing them with the data. So I'm riding a fine line, but it's a fine line I'm pushing forward with. So
I've been teasing Hawaii because that's the nature of New Jerseyans. But congratulations to Hawaii. It is a beautiful document. And Allison in particular, hearing that your involvement there, we're very proud of ours, and we feel like it's very Jersey, and yours is very Hawaiian, and makes me want to visit. So congratulations to you guys. I'm only joking, but we are very competitive people in New Jersey.
Well, my husband's from Philly, so I understand.
Well, then you get it.
We got
They're
married.
worse.
We got married in Jackson, New Jersey, so I
Oh.
understand.
They're worse. Those Philadelphians, they're worse.
They may be, but I can't wait to read your plan, and congratulations. I definitely know what an accomplishment it is. It's like giving birth almost.
Oh,
Judith, I was born in New
I'm a
York.
consultant, and my
was-
husband would walk by me, and I'd be typing into the night like a lunatic, and he would go, "Hon, any billable hours in this thing?" "No, hon." And then he'd walk away.
Judith, my mom was born in Teaneck. Okay, I was born in New York, but she's sitting about 15 feet that way. I'm visiting her right now.
One of
So
my first jobs was Leonia, right next door to Tina.
that's where she was born. So I understand the whole competitive nature thing.
Awesome. Well, we're about 15 minutes over, so I want to give people back their day, but it's been a great conversation. I think there's so much more to talk about still, and and certainly the more plans that start to be developed, the more discussion we'll be able to have around how people have done it, what has worked for them, what hasn't worked for them, what's been different from state to state or community to community. So I think it just begs additional conversation. And certainly I think there's some opportunity to bring in, some best practices that everyone has kind of deciphered as they've gone through the process, and see big picture across the board, what have those best practices been to help guide those that are not yet in the space, right? And certainly those are resources that we would love to be able to provide from a national standpoint. So
Tina, if
anyway.
anybody just Googles New Jersey Water Safety Strategy, we're very proud of all the media. And if that
Yeah.
helps anybody, just general Google New Jersey Water Safety Strategy and see how it went down.
Great. All right. Well, thank you all very much for your time today. It's been a pleasure. Have a good one.
Aloha.
Thank
Aloha.
you.
Aloha.